we see.
Vitreous body is a clear, light, transparent eye spot. The visualization of vitreous structure and their change after the during pathological process caused by the diabetes did not provide it. The purpose of the study was to study the possibility to develop vitreous body development technique in proliferative diabetic vitreoretinopathy diagnostic. We have many classifications, but in this study, we speak about Kroll classification. Kroll classification, ophthalmoscopy-based optical clear tissue requested, not possibility in the hemophthalmos causes of the opacity. The Kroll classification have state A, B, and C. But in this classification analysis, ophthalmoscopy-based classification since tissue optical transparency elimination, anterior and central vitreous evolution non-possible, lack of the visibility of layer by layer posterior vitreous cortex and vitreoretinal interface with general structures of which are recorded in the main areas of pathological process developed as PVR. Classification are based on the assessment and elevation changes. We have our method, vitreocontrastography, vitreous visualization technology allows discuss normal vitreal and pathological change during surgery. Since millennium 20, the original dye vitreocontrast is development in all intravitreal pathology in the Fyodorov eyes microsurgery complex. This method called vitreocontrastography, and we can see all structure of the vitreous body and do step-by-step original method to micromicroscopic preparation of vitreous. Now I can say about patient. The inclusion criteria of patients to the study corresponded in the traditional PVR classification. According to it, patients were divided in 3 groups. The first group included 52 patients. In the second group was 47 patients, and the third group, 32 eyes. All of these have diabetes, and you can see our surgical technique in the eye with proliferative vitreoretinopathy. You can see the first study of the vitreoretinal proliferative diabetic study. You can see the retina with thin cortex on the surface of the retina. The special dye contrasting this layer, and step by step we work with the retina and posterior vitreous with vitreous, and you can see as we step by step clear the retina. In this our study, we described about classification and opened new stage A1. In this stage, anterior cortical layers are presentives, vitreous body structures are presentives and cisterns. The retina is fully attached without the visible ophthalmological changes of the vitreous and retina. Vitreous body layer with central topography in the eye fundus. And You can see the next group, and you can see fundus with eye with proliferative diabetic retinopathy. You can see the changes on the vitreous. You can see scar on the retina, and surgical technique to clear the vitreous and clear the retina. The step-by-step we clear the vitreous and clear the retina. All patients had 25 gauge vitrectomy with the constellation vision system and the operation microscope topcon. Vitreocontrastography method was used to contrast the structure of the vitreous. For this purpose, 3 port positions were installed pars plana 4 millimeters from the limbus. Vitreocontrast suspensions was injected through and the installed port in the vitreous body with the 30 gauge needle in order to the contrast retrociliary and equatorial cisterns in all cases. And then you can see the cortical layers and changes on the fundus to the retina. These changes was because patient has diabetes. During central vitrectomy, we completely removes without cortex contrasting. After complete vitreous removal, in all cases, the retina was detached, and you can see the work with the vitreous on the detached retina. The next case is the proliferative diabetic retinopathy, study B. Cortical layers in the central zone have lamellar structure, including 2, 3, 5, sometimes 7 vitreous layers, forming numerous vitreous zone, then cause structural retinal detachment. Along the vitreous layer, neovascularization proliferates and cellular proliferation occurs, forming a typical picture of eye fundus changes. Vitreous body layer adjacent to the retina may be partially mechanically removed. And you can see the next study, the next patient with proliferative diabetic retinopathy, study C. You can see visualized bursa-like cavities, the cisterns, and then you can see detached retina and very big, very strong scar on the surface of retina. And surgeon step by step walked to the tissue, scar, and clear the retina. You can see changes of retina, you can see scar. And our walk in the vitreous cavity. The presence of well visualization bursa-like cavities in 1.5 millimeter long, and both of the cavities are preserved. Cortical layers have areas of fixation to the vitreous body. They are removed only by intraoperative posterior vitreal detachment induction, or cannot be completely removed, staining fix the place of the film contrast with the return. Vitreocontrastography help us to see all study in the vitreous body, and we can say about new study I1, and we have a new dye vitreocontrast and new way vitreocontrastography in the surgical practice. And all our investigation you can see in this book, and you can see new new proliferative diabetic vitreoretinopathy classification. Thank you.